Hello, this is Kimberly Allen, and this is section 2 of 8 sessions that I'm doing on the role of peer recovery and family support in optimizing integrated health outcomes. So we'll be talking about integrated health today, and as we go along, hopefully you will learn more about integrated health if that's not something that you already know about. This project is part of Texans for Recovery and Resiliency, and TRR is a SAMHSA-supported collaboration between the Family Mental Health Network, which is the Texas Federation of Families for Children's Mental Health, and the Addiction Recovery Community statewide network, RecoveryPeople. So the purpose of this collaboration is to strengthen the peer and family voices in mental health and substance use recovery policy and program development. So when we talk about primary care, we're talking about primary care that includes the diagnosis and treatment of acute and chronic illnesses in a variety of health settings. So a lot of times when people think about primary care, they think about their doctor's office, and that makes sense. But primary care is oftentimes your first entry into healthcare. So it could include another setting, and we'll talk more about that. But primary care is involved in disease prevention and health maintenance, and patient education, and in health promotion as a whole. Primary care provides patient advocacy into the healthcare system, or at least that's the idea behind it, patient advocacy. It helps to accomplish cost-effective care by coordination into healthcare services. So you may be familiar with this. You may go to your doctor and you may have a special situation, and he helps coordination of healthcare and refers you to another doctor. So people often seek behavioral health care in primary care settings. It doesn't mean that everything always goes well, but they do seek behavioral health in primary care settings. And there are challenges there in primary care. Primary care clinics are very busy. The physicians have limited time with patients. Patients are often not evaluated for mental health conditions and or substance use disorders. Medical needs supersede other issues, and there are varying cultural beliefs and attitudes when people enter primary care medical environments. Oftentimes there's low availability of mental health services, especially in rural areas. So people with behavioral health challenges face those in primary care. One of those is that there are disconnects between primary care and behavioral health care. So that can be very difficult to deal with for everyone concerned. This is a quote from a group of 9 family physicians. When I was conducting these interviews, I talked to a number of primary care clinics. This is exemplary of part of what I faced. While working in the clinic, I don't have 20 minutes to talk to you. So these physicians, I think, were very caring. They just didn't have 20 minutes. And we probably know that. If you've ever sat in a waiting room waiting for a physician, then you're familiar that the physician's often very busy. This is another quote from a regional healthcare system. This group has over 10 hospitals and 30 clinics. My question was centered around, what do you do when you have a mental health or a substance use disorder concern with your patients? And she said, if it involves mental health, normally everything we do is based off insurance. We make a lot of calls. We see who is available off insurance, or we use MHMR. We may make a referral to a local psychiatrist. It depends on their insurance. Or if they drive, we use a resource that's closest to us. Peers? I don't think I know what those are. So when I mention peers as a solution potentially from this, let's say someone doesn't have insurance, peers may be able to help with that. We may be able to make the referral more fluid, or we may know of a source or a community resource that's not involved in insurance. So here we see the strong role that insurance plays when people make a referral from a medical environment to a psychiatric environment or other mental health services. It often is based off insurance. This quote is from a Midsized Group. This is specialty physicians that work with diabetes and other special health conditions. I ask once again, what do you do if someone comes in and they're diagnosed with a very serious issue? In terms of mental health, we make direct referrals to psychiatrists, though many are full and do not take insurance. I just make referrals to psychiatrists I know. We do not use peers for either diabetes or behavioral health. So sometimes we do see peers utilized in treatment used for diabetes. So in this case, we see a physician making referral to a psychiatrist, often those that he knows. He may not know anybody else. And this is a big problem that many psychiatrists are full and don't take insurance. So we're facing this right and left with mental health concerns and substance use disorders. Here's another clinic. This clinic involved 30 independent physicians. I was speaking with a physician that knows that healthcare environment very well. He says, peers, I've heard of those, I think, but I am the one who handles psychiatric needs for our practice now. I act as the managing director related to mental illness. I'm not board certified in psychiatry, but I see mental illness no differently than diabetes. I wish more people talked about it. So here we see someone who's working with a large group. He is not board certified in psychiatry. He is very caring. I talked to him for quite a while. I can appreciate that he doesn't see mental illness any differently than diabetes, and he does want people to talk more about it. So I think that he was talking more about patients talking about it and physicians themselves. He also went on to say, I do know that some people go to the emergency room, they do not need to, and many times they're bumped back due to other needs. We need more community resources. So he is very familiar with psychiatric patients going into emergency rooms and then coming back to see him. These aren't emergent needs. They've had a bad day and they get referred back to him. And he knows that we need more community resources for these patients or individuals to see in the interim when they're having challenges or need support. This is the community healthcare clinic that did believe so much in behavioral health care support. We will be utilizing a recovery coach to support patients that are identified as having substance use disorders at the end of this month. Mental health supporters is something we are looking at and maybe initiating later this year. So that was very refreshing. So there are clinics and other community clinics that do utilize peer support. We are starting to see that. So I did see it here. Despite all of my calls in primary care, not everybody said no. This is an example where someone's saying, yes, we are going to start using peers. So this is a look at how primary care systems do use peers, peer supporters, and family partners, or certainly how they could use them. Primary care provides an opportunity for prevention, and peer support could intervene before issues develop or worsen. Peers could reach people who cannot or will not access specialty behavioral health care. So there are a lot of people who may have been introduced to specialty care, mental health care, or treatment for substance use disorders, but they either cannot access that care because they have some form of limitations, for example, transportation, or they will not because this is something that culturally may be viewed as some sort of weakness or something that they shouldn't do. So if peers can reach these people, they may help to eliminate the early mortality gap. Peers could act as cultural bridges, which is what we were just talking about. They can talk to, listen to, and connect with individuals about their behavioral health and medical needs in a productive way. They can make individuals aware that they have the power to be an active participant in their care and achieve wellness goals. So the patient can actually speak up and be a participant in their care instead of just saying, yes, I'm going to go ahead and do that, or no, I'm not going to do that. They can be an active participant. Peers can empower patients to be more involved in their health care, and this is key across the continuum of care So we can see peers helping individuals build that bridge between mental health care or behavioral health and medical care. Peers can share our lived experience. We are talking about our own recovery issues that we have faced, and we can be involved in stigma reduction. Oftentimes we reduce stigma just by being present and being on the road to recovery and resiliency. Peers can promote and enhance patient engagement, so we can promote the idea that patients can engage with physicians, engage with us, and engage in community resources. We can encourage patient contact with their healthcare providers. We can help to build trust and a common language so that peers in the medical community understand each other. We can help people review the information that's shared by the physician during the medical appointment and ensure that the person understands the information as it relates to them. So a lot of times people just don't totally grasp what the physician said. I certainly have had that issue before. I think a lot of people do. And all it takes is an explanation and say, how does it relate to me as an individual? What can I do to stay well? Peers can ensure that the individual has support and skill to inform the decision-making and planning process. So sometimes it does involve support to inform the planning that goes into involve your health care. You need planning and you need support in order to make a decision. That makes sense. And we can help patients to communicate treatment preferences. We can help patients navigate through the healthcare system like we talked about before. These systems are fragmented, so peers can help navigate through the complexity that represents healthcare today. We can help patients schedule and coordinate appointments, and peers can help patients prepare for those appointments. So a lot of times it's just gathering information. For example, what kind of meds do you take if you do take meds? What kind of exercise do you do? What's your family history? Things along those lines. We can just help people prepare. We can assist in transitions between primary care and mental health settings, assist with warm handoffs. This is an integrated care technique where the primary care provider directly introduces the patient to a behavioral health specialist. So we can assist in that. We can go with people to these appointments and help with those warm handoffs. That is much, much warmer and much, much easier than just walking in to a behavioral health specialist and say, here I am. You know, apparently I've been diagnosed with something, or there's a supposition that I have a mental health condition or that I have substance use disorders. That can be very tough to face on your own without a warm handoff. We also work with individuals in all health systems to ensure that people keep a file or a notebook of all of their information. So it's always helpful once you've spoken to a provider to keep that information on you so that as you move through these systems, you have it. We also act as a transition guide or a transition agent back to medical health. So a lot of times people may think more about medical services referring us to mental health, but peers often act to assist people back from mental health back to medical services. So the arrow really goes both ways. We help support individuals in the recovery process. Peers help individuals to build their resiliency, and peers provide direct support to individuals needing support. We also assist patients and their families with accessing community resources, social services, and transportation. So we help with patient motivation, education, and empowerment, but we also help with families, which is something that I think people don't talk enough about, and it is often overlooked. I thought this quote was interesting. This was from a leader in a large regional psychiatric medical group. He says, if the family is engaged with the consumer, it can make or break their success. So that's a very impactful statement from someone that deals with patients with psychiatric concerns or substance use disorders on a daily basis. And he is encouraging us to engage the family in treatment and recovery and support. If you have more questions about this segment, we certainly hope you watch the other videos in this series of 8. And you can certainly contact me at the email that you see listed here, Kimberly Allen at RecoveryPeople.org. We do have a website, RecoveryPeople.org, and we have Recovery and Resiliency.org. Thanks for listening in today.